Today, our title for the webinar is "The Word is Yours. What more can we do together?" This is a new interactive session. This is the first for our working group, and it was designed to give every working group member the opportunity to share their ideas and help shape our future of working group together. And so thank you very much for joining us here today. Before we start through the questions, I would like to say that I'm very excited for the SIOP 2025 annual meeting, which will be held in Amsterdam between 20 and 23rd of October. And I would like to remind all the participants here that early registration deadline will be on 23rd of July. And if you need a visa to travel to Netherlands, upon request, the SIOP 2025 Congress Secretariat will send personal invitation letters to the participants if you want. I don't know if you have been in Netherlands or Amsterdam before, but it is a very nice city. The best thing about Amsterdam from my side is you can look at the city just by walking, and you can see the beautiful canals and the beautiful museums, and there are lots of nice cafes, and you can find something for yourself in the city. And I would like to give the words to my co-chair, to Michael McNeil, and then to Professor Dr. Regin Kebudi, the General Secretary of SIOP, for the greetings. And then we can skip to the question one. Okay?
Perfect. Thank you so much, Dr. Murai. It is a pleasure to see you all here today. And for those that have completed the survey, for those that are here with us, we're very excited for the opportunity to talk today and make this really more of an engaging and interactive session to really understand what are the needs of this working group, what are the hopes for this working group, and how we can better fulfill those. At the same time, we're also excited to try and get as many people together as we can while in Amsterdam. It's going to be a wonderful experience. There are several sessions and a whole free paper session dedicated to palliative care, and some opportunities hopefully during the education day and other spaces to really be able to engage and interact and intentionally build this global palliative care community for children with cancer. And so just very thrilled and appreciative of all that you do. Thank you to Dr. Murai and her leadership as the co-chair with this program. And really, this is her brainchild. Her idea is really kind of bringing this all together and trying to make sure that this is an opportunity for us to really know how to better serve you all. And so thank you guys very much. And I'll pass it off to Dr. Kebudi.
Thank you so much. Thank you, Michael and Mirai, for inviting me as a guest contributor. Michael, as you all know, is very much involved in palliative care. He's a world leader in palliative care. And Mirai is also on those steps, both as co-chair, but also because she's doing a PhD in palliative care as well, and she's very interested in the subject. And I was, in fact, the one that first initiated that PhD program in our university for palliative care and supportive care cancer patients, because we have always to think holistically. We have to think of the treatment and also of the supportive care, palliative care, which is very important. And I think this was very good to initiate this webinar. In fact, this is an interactive session to see what people need and what can we improve more. And Mirai, well, you have told about Amsterdam so much that I have to tell Rob, our coming president, that you are more eager to talk about Amsterdam. So we are all looking forward to Amsterdam, but you feel that the rhythm of Amsterdam when we listen to you. So I think we will have a very nice in-person meeting in Amsterdam. Yeah. That was really good. And with this, I thank you both, and I will just try to contribute if I can at the end. Thank you so much.
Thank you, Dr. Regin and Dr. Neil. And you know, Dr. Kebudi, I'm one of the ambassadors of SIOP, so maybe we can make some connections in during the meeting there, the members of SIOP. Thank you very much again for joining us here today. I want to skip to the questions, but okay, yes. The topic of our webinar today is the word is yours. What more can we do together? Our aim as the working group is to create a welcoming space for working group members, for you to share your voice, your decisions, your thoughts, your suggestions for the group. And so we think that this interactive session would allow us to gather feedback on your expectations from us and identify areas where you would like to contribute, for example, mentorship, webinars, or advocacy, and discuss potential themes for future sessions or even for the next SIOP Congress. And the first question on the survey was, and you can also answer the questions which will be sent to you by Anelia during the webinar. The first question is, which aspects of global collaboration in pediatric palliative care are most important to you? And here is the ranking according to the number of responses received from the survey. The answers were like here. The top ranked ones are increasing access to education and mentorship, respecting and integrating unique cultural perspectives, participating in international research and collaborations, sharing knowledge, resources, and best practices, advancing advocacy efforts and policy initiatives, fostering moral and professional solidarity. Based on your responses, we have extracted some key takeaways about the first question. Those are first, education and mentorship emerge as a top priority. All members view these as a critical component of global collaboration. Second, respecting and integrating cultural differences is also important to all participants, 100%, reflecting the group's cultural sensitivity and awareness of local context. So it's very parallel to the context of SIOP community, you know. And the third, international research collaborations received high interest, indicating a strong willingness among members to contribute academically also. Sharing knowledge and best practices was also highly valued. It suggests a potential need for more structural exchange mechanisms. And this last one, advocacy and professional solidarity were seen as important as well. And as we have made some recommendations for you, and we can make some proposals about these recommendations to the SIOP directory. So Dr. Kabuti is here for this also, actually. These recommendations are like this. First, a strategic plan for education and mentorship could be developed by maybe launching regional mentorship pairings and by sharing an online library or create a list of educational resources. Second one, a webinar series focused on cultural diversity could be introduced. For example, sessions can be prepared featuring speakers from different regions under the theme like cultural perspectives in pediatric palliative care. The third one, a platform to support resource collaboration could be established. We can create an email group or forum to share potential resource topics, and people who are interested in can join. And we can disseminate funding opportunities and calls for proposals regularly. The fourth, to enhance knowledge exchange, consider launching a monthly initiative such as, for example, a best practice spotlight, for example, by email or through webinar series. And the last one, the advocacy focused content should be included by sharing information about international initiatives or campaigns related to improving access to pediatric palliative care. So this was the first question of the survey, and you have seen the top ranking answers here. And here are the findings, and these are the recommendations. Is there anyone who would like to contribute about this question? or any thoughts from the community here?
Maybe we could take Michael's opinion on these subjects, as he is one of the most experienced people, persons in the world.
No, I think it was really interesting to kind of see some of these things, right? I think not surprisingly, all of these elements were important. And it was kind of hard to really fine tune some of these things because all of them were well above 50% and well above 75%, right? And so I think all of these things are opportunities for us to really consider. But I think the things that really stood out for me were the opportunities for mentorship and the opportunities for really getting the experiences from different contexts. And I think that's one of the things for us to really consider as we kind of work through some of this, and really having that strategy for education and mentorship and really thinking about how do we ensure that those two things are put together, right? With regards to having mentors that are aware of the cultural context in which our community is working in. Recognizing that there's opportunities for global mentorship and having folks from different contexts is also beneficial. But having someone who's from the region, who works in the region, who knows the region, who knows the experiences, to be willing and able to mentor someone who's interested or engaged in this space, and to be able to have that as a part of that, I think will be really important. The other one that really struck me, and I'm always interested in, and I love to see that being very high, is the excitement about research. And I think that that also can play a role in this contextual component as well as with education and mentorship. Many of us are interested in research, but not all of us have done it before. And so you need mentorship and education on how to do research. And so I think that there's some spaces for us to be able to do that. The other big thing as well is, as we've talked about, the power of having research from the context in which we're practicing, and not saying, oh, this is coming from Europe, or this is from Canada, or this is coming from the United States, but rather saying, hey, this research was performed, done, and published about our experience in Turkey, or our experience in Malawi, or our experience in Mexico, and the power that that provides, because that also assures that we have those perspectives from the different contexts. And there may be similarities to what has been found in the literature based off of these different things, but there may be some unique features that are beneficial as we advance that. So I think that those are important findings and things that will help us both as we prepare for Amsterdam, but then also as we start thinking about future webinar sessions.
Yeah, thank you very much, Michael. I agree with you strongly, because a volunteer mentorship program could be established within real local settings. Because after we have completed all the questions and answers, we will see that it's a very important area that the members are giving their ideas. Yes.
It will be nice to take the opinion of the participants also, if they want to. The thing with the mentorship is very good, having one-to-one mentorship. Of course, we have to have mentors that have the time, that they can contribute that time with the people, with the ones that are asking for mentorship. And doing it in the region, as Michael has said, is better because they will know the cultural sensitivities. In that regard, if we are planning, like you two leading this effort, may also contact the continental presidents, because in SIOP we have really very nice 6 continental presidents that are doing a lot of things. And now in Asia, in SIOP Asia, there are also 4 different subgroups according to the WHO regions classifications. And also there are, so it could be that they could be involved also in finding these mentors. And the other thing, like as Michael has said, and you have said for mentorship, I'm also involved in the American Society of Clinical Oncology. In the women networking setting, I do the mentorships a lot, and I am also the chair of the International Development and Education Committee. There are some mentorship opportunities which we can take examples of in SIOP. It could be mentorship year long, but also there are some volunteer mentorship for because as I say, it is not easy to find the mentors also because they are also very few in number and also very their time is limited. It could be only once, only twice to have that kind. But of course, it will be up to you to find the mentors so that the participants, you could match the participants with the mentors from various settings or countries. It is good if it is a longer in person or longer online meeting and mentoring for a long time, but even once could be good. Even once could be good. So it could be mentoring for once, depending on what the participant wants. They know about palliative care, they want to make a service for palliative, or they do not have anyone for palliative care. It is a nurse or a physician that wants to do some palliative care, because in many settings you will not find a different person that the Ministry of Health will pay for palliative care. But so depending on the needs, it would be nice to mentor them according to the needs, as Michael has said, but it will be up to you also to find the mentors. Michael, maybe you, because of your worldwide network in mentors, it could be easier with the continental presidents to find those kind of mentors and to match them. Even once is very important, but if it is longer, of course, it's better. Depending on the projects, I'll try to do it at the end, like what kind of resources does SIOP have for that? Yeah, for research opportunities and so on.
Wonderful. Yes, I think that's a great idea. And certainly we have a community of folks that I think would be interested in providing some mentorship opportunities, both regionally as well as globally. And so I think that would be wonderful. And so, and again, in the chat, in the group, for those that are here, please feel free to type in the chat if these kind of components or discussion points resonate with you. If you have any other thoughts or suggestions with regards to some of the findings that we have from the survey, or anything else that you feel like you would need, or if you sit back and say, gosh, what you're talking about actually is not relevant for me or is not valuable, and I think that we should go a different direction, please let us know as well.
Michael, would you like me to skip the second question?
Perfect. Yes, please.
Okay.
So the second question that we did was with regards to the types of support that that you all would be interested in, that would be most helpful. Again, great response. Again, all of them were seen to be valuable, but there were definitely some things that really kind of rose to the surface with regards to activities or engagement that was seen to be of most value, similarly to what we saw in the previous question. So thinking about online education and webinars, opportunities for case-based discussions and how that could be incorporated into this, and then also opportunities to collaborate with research initiatives. There are also mentorship and support networks was great, as well as that kind of culturally adapted clinical guidelines. But we look and kind of see some of the ones with the higher interest, or with regards to, again, education and research. Next slide. And so, again, the big findings with regards to those three that kind of were the most frequently chosen, but then also thinking about peer support networks and then those culturally supported guidelines. And Maria, I see in your chat, right, that you do have some mentorship in country, but also thinking about how to have that in the region and globally, and not only having those that are in the context, but also learning about different contexts. I think that is a great point and a super important point, especially as we think about how this world is now global, and you in Romania may be engaging with patients that are coming from different cultures or contexts. I know here we've had to engage a lot with our collaborators in Latin America and in Spanish-speaking patients to better understand, their cultures and context to be able to support. So I think that that's a great point. And Maria, I don't know if you have any other comments or thoughts with regards to that.
I will think and I will write it down when I will see.
Perfect.
Thank you.
Perfect. Lovely. Thank you. But I think that that's a great point. And so as we consider both regional support, but then also thinking about how to get that support from different areas and how to be able to learn. What is your experience like in Romania? How similar and different is that from Turkey? How similar is that from Mexico or from Argentina or from Botswana? And so some of the things that we've thought about with regards to how to engage with some of these different specific activities are, again, continuing these webinar series. It was seen that these webinar series are beneficial, and how to
Yeah.
now, seeing from your thoughts, Maria, how can we make it where we're getting diverse perspectives from around the world and not just having the same regions present or the same countries, but having, and we've tried to do that. And we've had sessions from folks from India, from Africa, from Turkey, and how we can continue to have those types of engagements. But the one that I think would be interesting and would love to hear your thoughts as a group or with regards to case discussions. This is one that we've heard, at least from our palliative care program here at St. Jude, is people are always interested in how having opportunities to talk about cases and how that is really the foundation of our work, is taking care of patients. And so if you have a difficult case experience or a patient experience, or if you have, something to share and how to be able to engage in a community to help with that. And again, thinking through the research support, thinking through, kind of thinking about, hey, we've got a great research idea. How do we bring that together? And how do we introduce that to other members of the community to be able to work together on this? Additionally, thinking through the mentorship and support networks and how to leverage that potentially for some of these other programs we're discussing, and then thinking through guideline development. And that's definitely something that we're working with in collaboration with SIOP for some palliative care related topics through a program known as ARIA that I'm happy to share at another time. But I'm going to pause there because I've spoken a lot. But here, are there other thoughts or ideas that kind of arise as we're thinking this, again, does this resonate with you all? Do you see,
Yeah.
yes, I think a case discussion would be wonderful, or yes, I think we need to continue with these diverse perspectives, or no, you're totally off track and we need to completely rethink how we're doing things?
Thank you very much, Michael. Does anyone who wants to make a comment or? No, I don't see anyone. Okay, I can skip to the question number 3. Yes.
Real quick, Mariah, before you get that, I
Okay.
think Jocelyn put something in the chat that I think is
Okay,
really, really
okay.
important.
Okay,
And
can you?
Jocelyn, I don't know if you're able to elaborate on this a little bit more or come off mute, because I think that this is something that is essential, because we may have a robust palliative care program. We may have great integration into the pediatric oncology space, but what happens when these patients go to other parts of the hospital, like the emergency room or the critical care unit? And I think that's another space. Jocelyn, I don't know if you want to elaborate on this a little bit more, or think through some of your challenges and opportunities and how to engage them with this working group.
Sure. Hi, everyone. I am Jocelyn. I am from Mexico, and I work in a pediatric oncology center. And as I was saying, we do have a very robust palliative care team, and they are very well integrated. They are pretty much involved in every stage of the patient, and that's wonderful. However, I am in charge of the emergency room, and I can see how we always struggle when the patient arrives to the emergency room. This is a moment when you are not able to go to the file of the patient and read all the thoughts that all the great team has already put in there. So you have to take very fast decisions. And sometimes this is really difficult. I know that this happens with all the pediatrician and even with me when the patient arrives in the emergency room. So I do believe that we need to keep work on building capacity in the staff that is in charge to receive these patients when they do have the acute symptoms that they will be presenting during this time of their disease.
No, wonderful point. And I think that that's super important in thinking about, the communities and the folks that we're talking to, right? And how this working group specifically, right? We are a palliative care working group in a pediatric oncology organization that's international and focus. That's a pretty narrow group. How can we leverage this working group in this community to be able to help in those scenarios, recognizing that these pediatricians who are working in the emergency room or nurses or other staff, how we can get them engaged with some of these learnings. And so I think that this is an opportunity and a challenge for us to kind of consider and thinking about how to engage that, to be able to talk through. Maybe there's a case that we can highlight, maybe there's an opportunity for mentorship, maybe there's a research project or something along those lines that can really hone in on how do we ensure that across the spectrum of care that these patients are getting across the healthcare systems can ensure that palliative care is integrated. So thank you so much for that comment. I think that's really helpful for us to kind of think through. Sorry, Mariah, but that was
No, thank you very
wonderful.
much
Thank
for
you,
your
Jocelyn.
comments. Thank you very much. Thank you. And the next one was, in which areas would you like to actively contribute? The ranking answers were receiving or offering mentorship again. I think our working group members are very interested in mentorship and presenting a case study, also suggesting speakers and other answers. Maybe we can follow up for clarification of these inputs. But this is very important because in many different aspects of these questions, the mentorship is one of the top priorities, I think. And receiving or offering mentorship is by far the most popular area of contribution. And I think they may be some members they who want to give also support, just not also only receiving support. Maybe they maybe some volunteer potential mentors among us here. I don't know. So we're going to work on this topic with Michael and make some proposals about this topic. And presenting a case study is considered an important form of contribution. And maybe we can make some monthly or bi-monthly webinars, which we can present a case based, for example, webinar. And maybe we can we can send emails before the webinars, which suggest speakers from the which we can get suggestions from the community for the topic and the speakers. So here are the recommendations. Again, the mentorship program, but I'm not going to go through this again. Planning regular sessions to support case study presentations, again, monthly or bi-monthly, and increase communication among the community. Do you want to make any other suggestions, or do you have any contributions? I think okay, sorry.
Sorry. You may remember that there were in the Global Health Network, the Discipline series on the 6 index cancers for the GIC Global Initiative for Childhood Cancer. And those were good examples for case studies. It was the format was first one of the fellows or younger colleagues presented the case, and then the discussion was made by 2 different expert or senior colleagues, one from high-income country, or even if both from a high-income country, one from Europe, one from North America. But this could be a nice format, like having a case study and then having 2 expert discussants, one from high-income country and from the local area. What do you think, Michael, about that?
I think that's fantastic. And I think that there's definitely a couple different models in which, we talk about mentorship as individual, but at least in my experience, I've benefited from multiple mentors from all over, right? And it's not just one or the other, but having kind of diverse perspectives in that mentorship, I think is wonderful. So I love that.
Yeah, that was, well, a suggestion for a webinar where you have both the case study presentation and then the discussants, which may help some people. And also, Mirai and Michael, you had in the webinars, in the first one, it was a colleague from India, I remember.
Yeah.
And the second one, a colleague from Pakistan. So, for example, those could be mentors for their local countries if they wish to, which I'm sure they would like
Yes.
to, yeah. Two potential mentors from the
Yeah.
local
You have
area.
already find out two potential mentors. Yes. Okay. Thank you very much.
One
Okay.
of the other thoughts that I had, Mariah, and I would love to hear from the group is, one of the things that we highlight so much about palliative care is how interprofessional it is. And the fact that it's not just physicians who do palliative care, but nurses, psychosocial professionals, um, spiritual care, child life, all of the above. And I would be curious from the group if it would be beneficial to try and identify not just folks from a region or from an area, but also from a discipline or a specialty or a profession with regard to mentorship. If you are a psychologist, what does it mean to have a mentor who is also a psychologist, or a nurse whose mentor is also a nurse? Would that be something that would be important for you? Same thing when it comes to the education or the case discussions, being able to have those perspectives, not just from the specialty as palliative care, but also from your roles and responsibilities as your particular profession and and responsibilities in that role might be. I don't know. Would that be something that would be important to kind of dive into, or is that too granular?
And what about inviting some parents to our webinars? Because I think our colleagues should see their perspectives for palliative care. When I was in Memphis for the global palliative care program, we have the opportunity to meet with the bereaved families, and it was a very different experience for me. I think it can be very useful for our members to meet with the parents. They can share their perspectives for palliative care.
I love that idea.
Mm-hmm.
I love that idea. And certainly, we are doing a lot more work with CCI. I mean, CCI is a part of the SIOP, right? Like they're joining conferences. And I think that there's a lot of opportunities there for that space. And it does look like from Jocelyn that, the idea of having that discipline focused mentorship, but also including different disciplines with regards to the case discussions could be very beneficial. So, okay, wonderful to hear.
And
And Dr.
also,
Kibudi, please.
oh, sorry. Yes. Yes, Dr. Kebudi. Do you
Well,
have?
Michael, the point that you have made is very important. Many disciplines, and also especially nurses, because in most of the settings, it is a nurse that is with the patient most of the time for a longer time of period, more hours. So I think it is very important, the role of nurses in palliative care. Every discipline is very important, of course, the physicians, nurses, psychologists, but it is, and Mira, I just wanted to ask to you, in the SIOP Connect, when you announce the webinar, usually from the SIOP Connect, it's the people that tick on the supportive care. But was this also announced in the SIOP Nursing SIOP Connect as well? Because I think it is so important that really the nurses, as Michael, you have said, in many settings, the nurses are very important
Yeah.
in the palliative care. And I'm not sure if, for example, I would like to know how many of our participants today are nurses. Do we have any nurse colleagues with us?
I think I don't have any information about how many colleagues are nurses or this, but
Maybe Amelia will look
maybe,
at it
yeah,
afterwards. Yeah.
yes.
I
And
think it's very important. Yeah.
and another thing, I have just have an idea just right now, because many of our families don't know much about palliative, what the palliative care is. So I have told you that we can suggest patients for guest speakers, but how about having these families as audience to make them to give knowledge about palliative care? with basic information they can understand. At the beginning, for example, we can every 6 months we can make webinars for just the families whose children are diagnosed with cancer. Many of them don't know about anything about cancer. I don't think that most of our families have knowledge about what palliative care is, because in Turkey, in my country, in my local institution, we are searching for palliative care unit for we don't have any palliative care support in our team. We are giving this service to our patients. They think that this is the end of life care. So maybe we can make just webinars twice a year for those families.
Mirai, there I have a little, I would think a little different. The thing is that in many low and middle income countries and in Turkey, because we don't have a hospice and we don't have a palliative care separate team, it is within the centers, the physicians, the pediatric oncologists, and the nurses, and the psychologist is not available in many parts. So it is the physicians and nurses that are taking care of the psychology as well. But we are having the training. We have the training for the nurses, training for the physicians, that palliative care is not the end of life and it should begin at the diagnosis. And so the thing is that the palliative care is given, but it is given embedded in the normal pediatric oncology service, the treatment, everything, which is in part good because we don't have any the other team. But it would be nice. The family, because they are getting all the palliative care symptom treatment, like the pain and everything within the context of the treatment, so they are getting the treatment, but you mean that they have to know that it is the palliative care that are taking. That you are right, because we have talked about this a lot of time, that what is the difference between supportive care and palliative care, because they are also quite, maybe Michael, you would like to answer that, but usually most of the things are in
Integrated.
both of them. And in many settings, it was, in fact, when I wrote a review on the palliative care globally in many countries, and there it was also said that many people, even in high-income countries, do not want to have the name of the service as palliative care, because although palliative care does not mean end-of-life care, because in the history it began that way, maybe because normally palliative care, the definition is that you begin with that at diagnosis, not at the end of life, at diagnosis. And if they recover and you have a cure, that's very good. But if, of course, there is a relapse or a death, palliative care is should be done from the diagnosis to the end of life. But many still palliative care in the community, people think that it is end of life care. Although we can tell this to the parents and to the children, not to children, but to the parents, but still first we have to tell it to the doctors and the healthcare professionals, because still many professionals think about it as end of life care. So I think I would like to get Michael's opinion on that also, as he is a longer time in this, he is professionally in the field of palliative care. And also, Michael, I would like to ask you, how do you do with the parents? Like Mirai said, shall we do a webinar with the parents or for the parents? How do you do it in St. Jude, which is where you are very experienced on this? So this may be an example for our other colleagues throughout the world.
Yeah, so I think one of my favorite studies, the one that I probably use the most often when having this discussion, is actually done by one of my colleagues here at St. Jude, Dr. Dina Levine, who's now the division chief for our quality of life program. And she did a very simple study that was published in, I think, 2017 now in JAMA Oncology, where she asked patients and families, first they described what palliative care was, and then asked patients and families, would they be interested in having palliative care be a part of their care? And when the patients and families understood that palliative care was the prevention and relief of suffering and the improvement in quality of life, almost universally, the patients and families were like, yes, absolutely. We want that as a part of our care. Why would we not want someone or a professional to focus on our quality of life? And so, really, the takeaway from that paper was that it's not only the parents or patients who are reticent or hesitant to have palliative care, but it's often us as healthcare professionals to introduce palliative care, and that to be able to help better educate our colleagues on what is palliative care, why does it matter, how to integrate it more effectively, develop a palliative care team that's robust enough to meet the needs of these patients and families are all essential as we also engage with parents and patients and families to understand that. And that, really engaging them from the outset are essential. I think, as you alluded to, Dr. Kabuti, I think one of the biggest successes to our program specifically is engaging with parents and families to help develop the program, to work with the program. We have parents that are not only involved as volunteers, but also mentor other parents who are engaged with creating our strategic plan. We have parents sit in our strategic planning meetings to help guide us as far as what we should be doing as a palliative care program. They're a part of our research projects, not just as participants in the research, but actually co-investigators, and they're co-authors in our publications. And really, I think that provides an opportunity not just for their involvement or their being informed, but actually collaborating and empowering them to help us better understand how can we better take care of them and their families. And I see Asma's comment as well, right? That these parents and patients and families really appreciate that they see, they're going through the worst experience of their life. They're going through the most difficult and challenging things, but to feel like that has purpose, that has meaning, that they can pay it forward to others, can really kind of go from there. So I love this idea. I love this conversation with regards to, how do we engage more meaningfully with all their disciplines? How do we engage more meaningfully to make sure that it's interprofessional in our mentorship, in our discussions? But then also, I love this idea of how do we bring parents into this? Asma, I love what you're bringing into the chat. I don't know if you are able to come off your mic and kind of highlight a little bit more some of your experiences with parents and family members.
Sure, Dr. Michael, and thank you so much for allowing me to give my input on that. I'm Asma from Pakistan, and we definitely have parents on board who are mentor for the bereaved parents, and they are serving their roles, and we have kind of started taking them on board in different programs, having their input, and they find it very meaningful because they are continuing their child's legacy. And it gives them a life, it gives them a meaning to their life. Not even parents, but I have seen and I have got the feedback from the siblings as well, that if they're part of that particular program where we have invited them as a facilitator, and they are attending their parents session and their talk, so they feel very confident and very passionate about it. So I think it's a really great idea to have parents as a task force in this journey. Thank you.
Thank you so much,
Thank you so
Asma.
much.
And thank all of you for kind of engaging and being a part of this conversation. Mariah, I don't know if you have any other comments, or I realize the time has gone fast. We only have 10 minutes left.
Yeah. Would you like to skip to the next question?
Yeah,
Or
let's again, it highlights the things that we've already talked about, right? That opportunities for courage, opportunities for member discussions, hands-on case discussion.
I can't hear Michael right now. Can you?
He's just gonna maybe Michael,
Yeah,
we can
It's not
hear
coming
you.
through.
Yeah,
Okay.
now we can hear you maybe.
Yes.
Yeah, my internet started acting up, so I turned off my camera for a sec. But I think yes, we can move on from this question, seeing as it's a similar theme from what we've seen about opportunities for research, opportunities for engagement and discussions, and in particular case discussions.
What about opportunities to co-author publications? And how
Yeah, and
can
I
we
think that that's
engage our
where.
memory?
Oh, go
Yeah.
ahead. No, I think that that's where the opportunities for the research comes in, right? Kind of how do we have that opportunity for engagement there, and would be intrigued to hear from the group as far as their own experiences with publications and how easy or difficult that was, and how this working group can help in that space.
Okay.
I know several of you have published before. I see several names of people who've been successful, and would love to hear kind of the challenges and opportunities and what support you would have liked to have had.
Yes. And I'm going through the other slides. Here are the webinar topics, top ranking webinar topics here. You see the advocacy and strategies in palliative care, 100%. And communication skills with children and families. This is a very important topic. I think we can go through with it because especially the cross-cultural communication is very important about palliative care. And we can arrange symptom management in variables, resource settings, webinars. These are the top ranking answers. And end-of-life care across cultures. Maybe we can have a session, part of a session in the annual meeting. Maybe we can have grief and bereavement across cultures, mental health and team support, ethical dilemmas in pediatric palliative care, and case-based clinical evidence again. So we're going to plan our future webinars, I think. Michael, what do you think according to these answers? Yeah.
Yeah, I
Top
think we have
priorities.
we have our webinars for the next couple of years. This is
Yeah.
great. We appreciate all of your thoughts and suggestions
I've
with
been
this.
planning.
Exactly. So
Okay.
I think that this is great. And certainly if there are other suggestions that you all have, please feel free to type them in the chat. Feel free to share with us via email or WhatsApp or what have you. This isn't the full breadth of palliative care, as you all know, but certainly it's interesting and exciting to see that there is a lot of interest in many of these different topics.
Yes, I'm very excited because the next webinars will be so targeted webinars for the community. Yeah. And these are the findings and our recommendations, although the similar ones with the previous ones. And here are the priorities, the summary, key themes from the member survey. I think we have talked about all the topics here: education and mentorship, advocacy and policy engagement, research and knowledge sharing, cultural sensitivity and local relevance, and connection and engagement. Yeah. And do you have any comments or thoughts about these topics? So we have just 6 minutes left because.
Well, I think although we have a limited number of participants, those are participants that are really, let me say, that are really focused on this subject. And it's very good to have those because this was like a webinar on planning what to do. So
Yeah.
I think thanks for all the ones that really gave impact to their insight to these surveys. And thank you for having these priorities and all these webinar subjects for the next year, at least, or for a few years, as Michael said.
Yeah.
That would be nice. I think you have another slide. The opportunities for research I would like to tell about the opportunities for research, but I think I will need like 2 minutes. When you're done, I can put on I can put on I can share the slides for the opportunities in 1 minute. Let me just do it. Sharing is not turned on, so I have to request to turn. Yeah, it is. I can just tell about it. So in first, networks, not working groups, but networks have can apply for projects, and these projects are usually announced each year. And each network, each working group within the network can apply for those projects as well. So there will be some funding opportunity, like in the supportive care. Mirai, you know about like Aslan, the psychologist, our senior psychologist, had done the Zippy project. It was a nice project for children, a playboard for symptoms and so on. So that was a project. So for palliative care, also the colleagues that are in supportive care, they don't have to be steering group members or leading persons, but if they have a nice project idea, they can apply for that within the network. The second is the PARK program, the pediatric. That is what I wanted to share, in fact, but
Yes, you
I
can
can share now.
Right.
Yeah, I can share now. So the PARK program, yeah, you can see it?
Yeah, we can share.
Yeah.
Yes, we can see your
Yeah, okay.
slides.
So this is the PARK program. This is for increasing research capacity in low and middle income countries. This is a committee, the PARK committee within SIOP. It is a global support for childhood cancer research cooperative groups. So for a research, it is not a center or only even not a national group that can apply. It has to be a regional effort, and they can apply through POEM, through Cancare Africa or Gallup or in Asia, because India's had a lot of centers. They could apply for that as well. And there is now in the phase 1, there were I think 4 grants, and now 3 grants that were given to cooperative groups. But there can be by your leadership, by Michael and you maybe, there could be such a project in one of these areas, and because this does have quite a lot of funding, and it could be a really good opportunity for a research. And in fact, in the PARK committee, there is a Naikong and Irang Chang family. Naikong, is the GD2 from Memorial. Naikong Chang is from Memorial Sloan Kettering. This is the Career Development Award, and provides funding to clinical investigators associated with working with PARK-affiliated cooperative groups. So there is an opportunity for research if it can be done regionally, especially. And at the moment, PARK, the committee is chaired by Carl Allen from the United States and Girish from India, I think. And the website is, you can reach the website from SIOP. If there is a brilliant idea for such a cooperative group research in palliative care, I think this will be really nice. And also the networks, and now the palliative care is within the Global Health Network. Each year, when we have enough funding in SIOP, it is announced that there are funding opportunities for projects. And if the project within the year before was completed and everything was the outcome, we had the results of that project. So that year, the network is entitled to receive a new for funding for a new project. So I think I'll stop sharing. So I think it will be nice that our the participants here and also the members of the palliative care, if they have a brilliant idea for a research, either through their networks or through the PARK, they can really do it. And maybe Michael, you and Mirai could lead a new idea for research for to engage many colleagues from one group, or at least it can be Gallup or POEM or the other group. Thank you so much. Yeah, I just
Thank you
wanted
very
to
much.
share that. Yeah.
Thank you very much, Dr. Rijin, for sharing us with this very important information. And I think we have a very short time, and I want to thank everybody for joining us here today and for taking the questions and giving us some contributions. And I also thanked Michael, my mentor, Dr. Kebede, for her comments. And I wish to see you in Amsterdam on site, and I hope the rest of your day goes well. Thank you very much.
All, and thank you for the invitation.
Take care, everyone.
Thank you
Okay.
for the invitation.